patients have positive MRI findings, why are some recommended for a more conservative approach instead of surgery?
Not all tears and injuries are created equally. So some patients will have an injury and it'll distinctly say a tear on an MRI, but that patient may heal on their own or get better without having a surgical treatment. So for example, meniscus tears are notorious for improving with conservative treatments and don't always require a surgery. So meniscus tear, we would generally have a period of non-operative care before going on to surgery.
How long is a typical conservative cycle before a follow-up visit is required?
Conservative treatment occurs for a minimum of 30 days and generally not more than 3 months. If a patient hasn't done at least 30 days of treatment, it's unlikely that they could get better from a conservative approach. If they do more than 3 months, at that point they're unlikely to get better and just harming themselves.
In general, what criteria is met to migrate a patient to a surgical candidate?
If a patient tries conservative treatment but continues to have significant pain or disability, they would become a surgical candidate. Certain patients will also start conservative treatments and then end up having more pain, instability of the joint, or problems, and then it declares itself as a surgical need earlier on in the process.
What are some examples of a conservative treatment plan?
Conservative treatment usually includes an injection into the area of pain. This could be a cortisone injection, which is an anti-inflammatory, Toradol, another type of anti-inflammatory, or even stem cells, which is a more recent treatment that's been pioneered, typically using a patient's fat to inject into the area of pain. After an injection, we usually match that with physical therapy and oral medications. Medications can be anti-inflammatory in nature. Generally, you don't prescribe pain medications, but medications that can help influence reducing the patient's pain.
For a patient who has a personal injury-related trauma, why is it sometimes important to exhaust conservative methods before providing a surgical recommendation?
It's important for a patient that's had an injury to do conservative care, sometimes to prove to themselves and everyone else that they've tried all the necessary treatments to get better before having a surgery. If you've done the non-operative care and continue to have pain, then it's very clear why you elected to have surgery. If you skip that stage, you may not prove to yourself that this was truly going to be a long-term problem without a surgical treatment.
Explain when the benefits of surgery outweigh a more conservative approach.
There are times where surgery is elected right away. This is typically for injuries that have no potential to heal themselves or for deformities. Certain injuries, such as knee ligament tears, like an anterior cruciate ligament tear, has no ability to repair itself. In this case, the patient will have pain and instability to the knee, so we typically would recommend surgery right away versus a non-operative approach. Other injuries, such as fractures like ankle fractures or wrist fractures, may have a deformity, and that deformity is not going to improve unless we do a surgical treatment to realign the extremity. Please feel free to contact us, and we hope we can be of assistance to you and your patients.